So I'd just like to say welcome to everyone on behalf of Peninsula Cancer Alliance, Target Ovarian Cancer and Ardens. My name is Claire and I'm a cancer care coordinator working for Torquay PCN. So the webinar today is going to be looking at how primary care make the most of the Ardens tools available to help us in diagnosing ovarian cancer at an earlier stage. If we could have the next slide, please. So with just a few housekeeping rules before we begin. So just to say the webinar is being recorded and a link to this is available via the Target Ovarian Cancer's YouTube channel to anyone interested in looking at this after. If you could keep yourself on mute, that would be great. And also, if you do have any questions, if these can be put in the chat, and we've got the team monitoring these. Also, there will be a couple of Slido slides coming up where we're asking for your sort of opinions. So you can either log on to slido.com now and use the code hashtag 3204039, or when the Slido comes up, there is actually a QR code as well if you want to wait until then and use the QR code. Next slide, please. So why we're looking at just a quick overview on why we're looking at ovarian cancer. So research co-funded by Target Ovarian Cancer has shown that the proportion of women diagnosed at an earlier stage, that's at 1 or 2, varies from 22 to 63% across England. And 1 in 7 women are actually diagnosed each year, who are diagnosed each year do actually die in the first 2 months after diagnosis. And this is generally to do with the fact that they're being diagnosed at a later stage. It's also sort of said that 40% of women actually believe that a cervical smear test detects ovarian cancer. Next slide, please. So looking at primary care, so awareness in primary care. So primary care does play a vital role in earlier diagnosis. It's those, as with many cancers, those women who present as an emergency in hospitals have a much poorer prognosis than those that are seen in GP surgeries. And 81% of GPs actually believe that ovarian cancer is a silent killer, and with 46% thinking that symptoms present at a later stage. And as we know, symptoms of ovarian cancer are very present at early stages of the disease. Over 25% of women make 3 or more GP visits before being referred for tests. And it has been shown that 85% of women who actually have ovarian cancer have said that they had at least 1 symptom within that first year of being before being diagnosed. So next slide, please. So as PCN, Torquay, one of our PCN Cancer DES targets was actually looking at barriers or breaking down barriers in early diagnosis of ovarian cancer. And back in May, I did reach out to Catherine at Target Ovarian Cancer, and we've been sort of working together to look at ways that we can sort of increase awareness within the surgeries. A couple of things that that I did, you know, to sort of to do this was making sure that the Ardens alert was activated in all of the surgeries, and also to sort of raise awareness within with the clinicians using the A5 red flag cards that are available from Target Ovarian Cancer. So we are, sort of working, sort of towards this earlier diagnosis within the surgeries. But of course, as with anything, there were problems. The main one for us being that was the alert actually being seen. And I think one of the problems with that was that the diagnosis of IBS and diverticulitis was not being made within primary care before doing further tests in secondary care. So again, this webinar hopefully is going to sort of address some of the issues that we've come across as a PCN and hopefully help to move things forward. So with this in mind, if we just go to the next slide, we have, like I mentioned earlier, the Slido. So just looking at how confident you are using the EMIS Web Ardens resources to support earlier diagnosis of ovarian cancer in your practice. So again, if you can use the code there by joining slido.com or use the QR code. And just whilst those results are coming in, if I could hand over to Chris Batley, who is a product specialist at Ardens for EMIS Web, and she will take you on to our main presentation.
So I'm really sorry, it's not letting me share my screen, Bill. Is that? Oh, will it let me now? Perfect, thank you. And I'm really sorry. Good afternoon. Thank you ever so much for inviting me to attend this session and to show you the resources that you should find in. Sorry, I don't use Zoom very often, so I do apologize. I'm a bit cat-handed. So we've gone straight into EMIS, and sorry, I'll just get myself straightened out and then we'll make a start. So this is a look at the resources that are available to help you identify an ovarian cancer diagnosis at the earliest opportunity and manage the ovarian cancer and other cancers in a good way using the Ardens resources. There have already been discussions between Dr. Barber and Dr. Dunlop of Ardens how we might update some of the resources so that they will make you aware of certain conditions, certain things the patient's suffering from that might suggest that an ovarian cancer is present. So what we look at today is slightly different to what you may see in the coming weeks as we try and add different triggers to alerts and other information and put in different links into some of the standard templates. The way I'm going to look at this cancer diagnosis this afternoon is by way of a patient journey from having that first diagnosis of possible IBS to, unfortunately, the patient getting an end-of-life diagnosis and looking at the Ardens resources that you might be able to use for these things. So Frida, bless her, a 62-year-old, has presented with the symptoms of IBS. I'm going to put in an IBS diagnosis. I'm pretty sure that's what it is. And then I'm going to go to the Ardens template to add the discussions I'm actually having with the patient. Now, anybody who is familiar with Ardens templates, you'll know you have the pages down on the left-hand side. Nothing is mandatory in any of our clinical templates. A lot of our clinical templates have now got a quick entry page. So this is better for GPs. So it's pulling all the information together that you might need in a 10-minute appointment, but you've also got the fuller pages that you might use at the same time. So again, it's up to you, whichever you use. So we'll go to the quick entry so we can put a bit of free text in templates. So I take the information, obviously, from the patient. Now, in any of our templates, just like in any other template, you have drop downs with coding free text, etc., so that you can put in information about the patient. As with any template, you can click on the double arrow that will show you other entries for this particular code. So you've got a good idea what's going on with the patient. I can tick the box impact on quality of life and then put some information in there. As you can tell, I'm not clinical. I do apologize. Sometimes in a tick box, you can put more than one. Sometimes it will be just one choice that you can have from the drop-down list. Now, you will be familiar, if you are familiar with the Ardens templates, that you will have hyperlinks into what we hope are useful websites. These will take you outside of EMIS, and in this case, for thinking about alternative diagnosis, which for this lady, because of her age, would obviously include ovarian cancer. Okay, so we can come down, we could record if we're doing the examination, any tests that we're doing, what the plan is, any advice that we've given, etc. You also have the familiar tick boxes that'll put that statement into the patient record to save you typing it up. Obviously, you can put in there if you're arranging a follow-up, and you can see at the bottom that you've got a patient information leaflet about irritable bowel. Now, one of the things that we are talking about doing is here your information not only about irritable bowel, but also about thinking about whether this might be ovarian cancer. In the management, again, here, thinking about adding links in for considering that this might be something other than IBS. When we save the template, all of this information is saved in the patient's electronic medical record. But at the moment, as you so rightly said, Claire, we can only see the pink box alert when we save the consultation. And obviously at this point, we put the patient has probably left the room, or it may be that you don't even notice that pink box if you've shrunk it down when you're actually doing the consultation. Any queries or questions about, I'm really sorry about that. Any queries or questions about what we've looked at so far?
Chris, there's none in the chat so far. So if people think of questions, just keep on putting them in the chat and we can come back to it. But I think you're safe to move on to the next bit. Okay.
Just before I move on, one of the things we spoke about with Dr. Barber was that we need the alert to display when we're still in the consultation. So we are looking at the triggers. At the moment, it's IBS and diverticulitis, but going forward, it may be possible to put that trigger on for other conditions that the patient's presenting with, such as recurrent UTIs or abdo pain. Okay.
Chris, sorry, a question has come through, and it's probably easier for you to deal with it now. The question is, if the clinician just puts a problem code of IBS without using the template, will the alert still appear?
Yes, it will. So as soon as that is saved in the patient medical record, the alert will appear in the pink box, because it's that IBS code at the moment that is triggering the pink box alert. Now, if you want to make sure that the pink box alert is active, and likewise the new alert that will come through in version 17.7, if we go up to your EMIS circle, down to configuration, and I believe more or less all the practices, I think there's just 15 at the moment, and if you are one of that 15, then it'd be template manager rather than resource publisher. If you go into resource publisher, now your Ardens resources will be in the shared folder, because we can publish out to you if you're a resource publisher practice. And in there, there'll be a folder called Ardens. In there, the Ardens Live Toolset, Clinical Safety Protocols, and in the cancer folder, there will be a new alert called Ovarian Cancer Pop-up. And if this won't be there yet, but what will happen is as soon as you put in that IBS diagnosis, then you will see an alert like this in the middle of the screen if the patient hasn't had a CA125 in the last 6 months. Okay. As I say, we are adding also into some of the templates alerts for links into it may be ovarian cancer. So if I just take you into a couple of the templates while we're here, into the Abdo resources, which I've suddenly forgotten where it is. There it is. So again, this has just been updated, and we've added in extra alerts for ovarian cancer, and you'll see those in other relevant templates as well, such as recurrent UTI, etc., where perhaps we should be more aware that this could be an alternative diagnosis. Okay, so we'll go back to Frida. And she's come back to practice after a CA125. Possibly this wasn't a definite diagnosis. It's something we need to think about. Now, you've got a template that's called suspected cancer. This template is to record things that the patient is presenting with today. So it's taking everything the patient is complaining of or telling you about as of today. So if we come down, things that the patient might suggest ovarian cancer. So she might have abdo pain. She might have recurrent UTIs, perhaps an increased frequency to wee and an urgent desire to wee. She's perhaps suffering from back pain as well. Okay. We've also got in here a page that will show you all of the patient's recent investigations. Okay. So looking down, we can see her recent tests that she's had. We can add in, if we've just done a CA125, perhaps hasn't come down the link yet, anything that's been recorded previously for this patient. But we can also record any non-specific features. Now, this is working with the guidance of NG12, and as you know, NG12 is a huge document. So what we've done here is, well, what this template and protocol will do is they will lead you to the right places in NG12 to suggest what, if this patient may be suffering from cancer, and certainly what type of cancer it may be, and what action you should take. Okay, so patients suffering, she's get loss of appetite, she's easily filled, she's also feeling a bit tired. When we save the template, sorry, system gone a bit slow now. Anybody working with EMIS will be familiar with this. It will then ask us if we want to launch the NG12, or we can see here all the things that we've spoken to the patient about, and it may be that we're actually completing this without the patient being present, and we remember another thing that she told us at the time, or it may be we've got the patient with us and we're actually having that chat now. So we can go back to the suspected cancer template to add additional information, or we can exit without going through the NG12. So it may be that either we can see, no, this definitely isn't cancer, it is IBS, or possibly it's obviously cancer, so we don't need to use the analyzer. But what I'm going to do is launch the NG12 analyzer. Now, because we put fatigue in, and this patient is either a smoker or an ex-smoker, it said to us, consider cancer. Well, we're already doing that, so we can just say okay there. And you can see here, the front page shows you the information we've added. And then you've got separate pages for each of the things, the conditions the patients complained about today. And then the final page gives you the nice recommendations to bring all those together. So if the patient hasn't got a CA125, it's saying make sure you do that. click here for information, for more information on tests for ovarian cancer. That will take you outside of your EMIS system to an ovarian cancer website. Consider a very urgent full blood test. Think about doing a fit test, perhaps offer an urgent chest x-ray, and obviously carry out additional assessments for that loss of appetite. Consider a non-urgent referral, but actually we think we probably need a more urgent referral here, perhaps to a 2-week wait to gynae, just to check whether there's any problem. So at the bottom, you've got a box to record what you're going to do. So I'm going to send the patient 2-week wait at gynae and request urgent. I'm then going to save the template. As I save the template, it will ask me if I want to launch the Ardens fast track safety netting template. Now, this is a really useful template to record what you're sending the patient for, any information you've given them about 2-week waits, and also it triggers an alert that will monitor to make sure that it's recorded that this patient's been seen in the oncology clinic. So if I launch a fast track, you may or may not be familiar with this. Although cancer safety netting is not part of IIF this year, it is part of service requirements. We've got a drop down to say what we're recording, what we're sending the patient for. And then at the bottom, we've got a link into a patient information leaflet for urgent referral. So for 2-week waits, we can record that we've given the patient that leaflet, that we've told them that it's likely to be that it should be within 2 weeks, and that it's likely to be a cancer diagnosis. When we save this template, that information obviously goes into the patient medical record. And when I save the template, or save the consultation, you can see that your practice could have an alert that says, actually, I need to send a task through to the secretary to ask her to do the 2-week wait. Actually, I've already sent a task isn't required. Okay. If you don't have that alert, it's in your resource publisher, down in the Ardens folder. It's under other protocols and it's task required. Okay, so I'm going to click task not required. Now the 2-week wait protocol will monitor that code to see whether it's recorded that the patient's been seen in the relevant oncology clinic. And if they haven't been seen within 21 days of the 2-week wait referral, then you will see an alert in the pink box telling you that it doesn't look as if this patient's been seen, and then whether you need to chase that up or not. And there are searches, obviously, that your admin team can use to make sure that as well that that's picked up. Any queries or questions about the cancer symptoms template?
Again, Chris, there's nothing in the chat. If you want to carry on, and we can always come back to this part of the resources at the end if people have questions they think about.
Perfect. So unfortunately, this lady has been diagnosed with ovarian cancer. We've had a letter from the hospital. So we're going to add the code in now. Make sure we're using the right QOF code. Now, if you should, by mistake, pick up the incorrect QOF code, the Arden system will alert you to the fact that you're not using a code recognised by QOF. Obviously, we want to get the patient onto the QOF register so that she's picked up for all of the requirements for QOF. So if I say, okay, Now, immediately you will see this alert. So whether you add this as an admin person, just adding the code in, or whether you make this diagnosis through a consultation, or if the next time you go into the patient, as you'll see when we do her next consultation, you will see this. So this is making us aware that as part of QoF, the patient needs to have that opportunity for discussion within the 3 months of diagnosis. And a good place to record this is the Ardens cancer template. So we'll go into the patient's consultations, add a consultation. Obviously, my patient is coming a lot today and she's had a very quick diagnosis. So I'm sorry about that. It's just the way the suspected cancer template works. So you will see that alert has popped up again. So if the patient came in a couple of weeks, you would see that there's still time for you to do that discussion. So if I say, okay, I'm seeing her for her ovarian cancer. And then I'm going to run the template for cancer. And this is a general cancer template. So it's not only covering off the things for QoF, but it's also covering off best practice and things you will discuss with the patient. So the first page, as in any of our chronic disease management templates, is about QoF. Anything that brings a payment into the practice has red writing in that section. So you can easily see what information is needed for QoF, for national contract, or even for local requirements on the locally commissioned page. You can see here that we've got a link into the Macmillan offer support at diagnosis, but you can also see that you've got the tick box that you can say that you've given information about the cancer support services. You've got a page for symptom reviews and then that cancer review at 3 months. You've also got more general pages, so things that you would discuss with the patient, and obviously you've got the encounter type there for 12 months after, signposting to Macmillan, benefit system supporting patients nearing the end of life, etc. Lifestyle for the patient, showing that you've done holistic needs assessment, obviously if they're still a smoker, and then the optional consents there to share additional information, colonoscopy performance status, World Health performance, making sure you've got all the patient's contact details, emergency contact details, next of kin, etc. And whether the patient's got an ADRT. The examination for a patient, investigations. So this again will bring through the latest investigations the patient's had, management guidance, patient resources, so things you might give the patient that hopefully they would find useful, and then if you need the patient to come back again. Now this is a diary entry and this can be picked up by the Ardens diary module. It will appear in the pink box as well if the patient comes to the front desk. When to think about referrals and who to refer to. And then obviously when we save that template, it'll put all of the information we've added there into the patient medical record. Did I notice, Karen and Catherine, that we've got any questions?
Sorry, I was on mute. It's an interesting question, Chris, and it might be something that Claire wants to talk about as well. It's a question from a cancer care coordinator. And what she's saying is that in her role, she wouldn't be in a position for filling out these templates. But they are valuable, aren't they, for cancer care coordinators to look at to understand what's happening in the practice. And I just thought you might have comments on that.
Definitely. I mean, if you're seeing a patient with cancer, you saw there that we've got the signposting page on there. Nothing is mandatory in these templates. So you would just feel what you're chatting with the patient about. If there are things that you can code, all the better. If you're talking to the patient about smoking, you're getting that smoking information, all the better. By recording everything in a consultation and a a template kind of gives a nice structure to a consultation. You're recording that information, building up the patient's history, so that obviously the next colleague, clinician who sees this patient can see all of that information recorded. So if we go into the cancer care review, oh, it's not on that page, obviously. Oh, can I remember? Yeah, it's in the review call page. No, it's not. Management guidance, referrals. Ignore me. You've then got signposting in there as well. So you can see here, you can record that the patient has been seen by a care coordinator. You can also obviously record assessment of needs and any signposting you might do for the patient's care as well. So yeah, although this is a clinical template, it's a template where you can add general information. So you might not do that cancer care review either at 3 or 12 months, but you are going to have those chats with the patient, which is really useful information to be recorded in the patient's medical record. Does that answer the question? Sorry, as well.
Very quickly, the cancer care coordinator's come back. She was referring to the initial template where the patient history was first recorded.
Okay, I'm sorry. So, but you would as a care coordinator, you wouldn't really use that diagnostic template, would you?
No, I think that's what she's saying. So we're just clarifying that that is the case.
Yeah, but all of that information would be stored in the patient's care history. So if you go into their care history, in there is everything that's been recorded about the patient. Or probably actually better would be to search through the consultations. Don't forget there's always a text search. So if you're looking for anything to do with ovarian cancer, you can just type in ovarian. Oh, it's not that, is it? So ovary. And that will bring up anything that that has got that into the patient's medical record, wherever that's recorded. I don't think I actually made the diagnosis, did I? Which is not very good. But so you would be able to find anything that refers to that, either in the consultations or, I know why, it was recorded as if it came in the letter, so it wasn't actually recorded in a consultation. So in that case, if you went into care history, anything that's recorded in the patient medical record is here, and you've got that text search again. So again, you could type in anything ovarian. But I was thinking in your case, you would probably be looking for what's been added in the consultations by the clinicians about that particular diagnosis. Sorry, I waffled on a bit there. Does that help at all?
I think so, but we can always come back to it if there's more questions later.
Perfect.
If I can just jump in as well, Chris, just very quickly from a cancer care point of view, just to say, for me, I think it's really useful this in that, you're showing, sort of when you use that diagnostic template for us as cancer care coordinators to see how that alert comes up, because, obviously we don't use that template, so we don't see what it says in either the pink box or in how it's going to show when the new one is out. So for me it's good just to see how the clinicians see that alert. And again, we use the cancer template more as a coordinator for those cancer care reviews, but like I say, it's interesting for me just to see how it's shown. So
okay, thank you. So sadly, Frida's now going towards end of life, and we have a template called the Future Care Plan. Now, you may in your area have a palliative care template, a palliative care Word document that you can use. And obviously what I'm showing you today is what's part of the Ardens toolset. But if you've got one that's accepted better locally, please don't feel that you have to use the Ardens one. But we do cover everything from, early diagnosis to a unfortunately, end of life. So patients come back again, and as I say, sadly reaching end of life. And the template that obviously, if we'd have recorded that we'd done the 3-monthly chat, that prompt, that alert would not have been shown. But if we go into the future care planning, now this template is slightly different. So introduction, patient consent. The first page is talking about something that's really quite important as somebody reaches end of life, is that they are happy to share additional information with other healthcare professionals as they reach that end of life. So that's the express consent or dissent for the patient. If the patient isn't rational enough to give that consent, then obviously it can be given by the next of kin. So, that's a really important part for end of life. So a little bit of introduction there, people who would be accessing. So again, you can have that chat with the patient. You've also got a link there into future planning website as well. One of the things we offer as Ardens is that we can localize templates for your ICB. What you will notice in some templates, and that can include the cancer templates, the probably not the cancer symptom one, the NG12, but other templates, you will see a page that perhaps says the name of your ICB. This will have codes in that are needed for your local area, for your local claims. So if you see a page that says the name of your ICB, it's always worth checking in there to see if there's anything that's appropriate for you to complete. Coming down the template, we can see we've got TEP. So more information about the patient. Who does the patient live with? We can, as with any template, see previous entries on that right-hand side. If you click on the double chevron, that will show you all the entries that have been made for that particular code. So we can see in October 22, she was still living alone. October 23, she was living alone, but in both cases, there was help available. And that's still the case. We can put in any risks. And again, don't forget, you can see what's previously been entered. But let's put some information in there. When the patient's got a power of attorney, you could add the name and the number in there. Where the power of attorney is held. If we haven't got the patient's next of kin, you can add in their next of kin here. Have they got an ADRT? Have they got a respect form? And there is an electronic respect form as part of your tool set. Have they got a palliative care plan? And as you can see, you can add in all of this information. We'll do a review of the personalised care and support plan. Other text considerations about, oh, sorry, didn't go down to the bottom there. And then you've got TEP. So in here, we can put in what the problem is. How it should be, what the TEP level is, and how it should be managed, or if there is a management plan in place, etc. And you can see here that you've got a link to TEP examples. Other considerations, so does the patient suffer from chronic type 2 respiratory failure? Have they got home oxygen? If they're diabetic? And all of these codes don't appear in SCR. So, you can obviously be as brave as you like here. My wishes, so the patient's wishes. Considerations of care before death, where they'd like to be cared for. where they'd like to die if possible, if they have a pacemaker. Considerations for care after death, willingness to be a tissue donor, sorry, and the fact that you've given the patient a my wishes leaflet. Put in any frailty in, the patient's frail, and obviously if they haven't got a named accountable GP, and then the gold standard framework. And then if you come down, you can see that sections are coded according to the gold standard framework. And tick the boxes as appropriate. Then end of life. Again, making sure you've got the accountable GP. If there's been a meeting, making sure that the meeting notes are scanned in, and the end of life diagnosis. When we save that template and save the consultation, I thought it was behaving very well. Sorry about this. Okay. We've already added the personal care and support, so we don't need to add that again. And then when we save the template, we can then go into create a letter and create the universal care plan that will merge the information that we put into that data entry template into the Word document. Now, I'm sure you know this, but with any document, it will be ticked by default. If you tick the top box and then untick, it will untick everything. So you can just include what you feel is relevant to the universal care plan. And that will then be merged, problem-wise, will be merged into the document, but other information will be merged in as appropriate. With the universal care plan, you can add, as you can with any document, so you can add other information, but as you can see, it's pulled through the information that we've added into the relevant parts, and that then can be printed off and left for the next healthcare professional, or obviously in a patient's home or wherever. Karen, Catherine, did we have any queries or questions about that?
We don't have a question specifically about that, but we do have a question about how these templates and systems compare to System 1. So I'm not sure if the person asking the question is actually a System 1 user, but Chris and Claire, if you would just want to say something about what we as a working group want to do around System 1 and how the two compare, that would be great.
As you will be aware, if you are a System 1 user or if you work across the two different sites, the templates are very, very different. And but the information that we will be gathering will be more or less the same. And I know that Claire and Catherine have got meetings with our System 1 team as well to make sure that they are as similar as we can make them. Claire, I don't know whether you've got anything to add to that.
Yeah, no, that's right. Yeah, so I mean, obviously this one, is based on the EMIS, but we are, there will be hopefully a similar chat for System 1 users as well, to try and get that same sort of information on both systems. So yeah, that will be coming.
Perfect. Now, There is a death documentation template that you can use to record the death. There are searches around death documentation, but there are just a couple of searches I would like to make you aware of. I think I'm okay for time, just very quickly. So if you come into EMIS Circle, into reporting, into population reporting, your Arden searches will be a folder somewhere in the hierarchy under your practice name. In the Arden searches, if you come down to 4.14, there is a search that is just for cancers. And in here, in the possible cancer folder, there is a search looking for those ladies that have got new IBS symptoms in the last 12 months, who have got abdo systems, who have got persistent UTIs. So making sure that if the patient's had that diagnosis and then not come back, if they're having recurrent UTIs, but it hasn't been noticed perhaps that they're very recurrent, then again, making sure that we're not missing those patients, that perhaps we should be exploring to see whether they've got the early signs of ovarian cancer. And the other search I always like to touch on is the case finder searches. Now, obviously, this isn't as specific to ovarian cancer as those other three searches that we looked at, but they are good searches to have a look at to make sure that we're not missing anybody, that they've got things in their patient medical records that suggest they perhaps should have a cancer diagnosis, but they haven't got one. They haven't got a QOF specific cancer diagnosis in their record at the moment. So well worth running these searches and just making sure that we're not missing anybody. And then just finally, and I know you want me to be quiet, in the time sensitive searches, you've also got those 005 and 004 searches, just making sure that we're not missing anybody who's had a new diagnosis of any cancers and not had either that discussion about what's available to them or had that 12-month review. Any queries or questions, anything you'd like me to go over before I finish?
Chris, there's just one more question. I'm not sure whether you'll be able to answer it now, but it's, are Ardens going to be updating the 2-week wait as it's now a 28-day target?
We are eventually. At the moment, we've left it as 2-week waits because the feedback we've had from a lot of practices is they would rather be aware that the patient hasn't been seen. And when we went into the alert, although it says, you know, it's 2-week wait and the patient hasn't been seen within 21 days, you can always see the referral date. So you would be able to see whether that was within the new 28 days. Going forward, I know the team are working on updating the 2-week fast track, but I haven't got a time frame for it, I'm afraid at the minute. But we feel that in the interim, the 2 with the 14 days is probably good enough for now. Okay, I'm sure you're all aware of the support desk that Ardens has, and also obviously there's a support website that you can go on at any point. I don't know why Zoom doesn't like me very much. I can't get back. I'll stop sharing, perhaps it'll let me then. I'm sure you're aware of that, but we also have a new tool that you might find useful. Bill, I don't know whether you could put that final slide up, please. It's called the Ardens Academy, and these are bite-sized training sessions that you can attend at any time. They're really quite useful because you can there's little quizzes and things in there that you can do, and they can be done at any time. As you can see, there's you can scan them or whatever. Okay, thank you ever so much for your time, and I'm sorry I made such a hash of using Zoom.
Right, I'm just going to finish off really. I help Target with looking at GP education and things, and so you know, we have some fantastic resources. Next slide, please. Just really to reiterate that abdominal cancer is ovarian cancer is an abdominal cancer, and using the templates reiterates that, because the good thing with Ardens is that they do have lots of reminders of this, and it stops us doing that compartmentalization that we tend to do, which is this is a gynae problem, this is a gastro problem, etc., and people get referred off and then come back to us and then have to be referred again, etc. The other advantage is that it's a good aid memoir about what tests to be doing. So if you're doing a FIT, for example, it will also advise you to do a CA125, and Arden's thankfully working to update these as we speak in the background. And for anybody that's worried about it popping up too often, for example, the IBS one, I did an audit of our patients, and we've got 13,000 patients, and only 23 times would that have triggered in the course of a year. So we're not talking about lots of people, thank goodness. So it's not something that you need to mute because you're getting fed up with it, thankfully. Next slide, please. We've got lots of resources at Target. Do get in contact with us if you want any nurse support. We've got, you know, anybody that's diagnosed with ovarian cancer, or if you're worried, or any of the resources. And if you have a look at the next page, next one, please. You've got these red flags. Now, this is something that I would definitely, you can either download or you can get them sent to you. And if you stick this on your wall, you're much more likely to remember the symptoms of ovarian cancer, which are the abdominal pain, bloating, urinary frequency, and feeling full up. And it just reminds you of the couple of things: never diagnose the IBS, and also watch out for your sterile urines of frequent presentation, etc. So please get those as a resource. And that's it from me. Thank you very much. So we're just going to do the last bit of the Slido. So and join. Oh yes. Just join our network as well. We are very, very keen on getting GPs to sign up, or anybody else who's a healthcare professional that would like extra information. Please sign up for our network. Thank you. Right, hopefully you can see this again and have another go at this. Time to do that. Just to say that Amy's put in the chat the links that we've put there if you wish to download anything. Very handy having those red flags, because they act as your own version of Arden's template on your wall. I think that's about it then. Any more questions that anybody wants to ask before we wrap this up and say thank you very much to Chris for her presentation? I don't think there's anything else in the chat that we haven't covered. So I think that will be it then. So thank you very much for everybody for logging on and joining us. Thank you to Claire. Oh, beg your pardon, I didn't realise there's another question. Do beg your pardon. Right, that's useful information. So thank you very much for anybody who's answered those. Yes, coding is very, very difficult, isn't it? But I mean, ovarian cancer is a subtle problem. And if you remember that it involves abdominal symptoms, you can't go far wrong, really. So certainly, if you've got a woman over 50 who's presenting with any version of abdominal symptoms, just remember ovarian cancer, and that means that you're much more likely to diagnose it. So thank you to Claire and to Christine and to Target for hosting this. And these are our contact details. Do get in touch with any of us if you want any information afterwards. So thank you very much.